Joining us now to discuss more about this, founding director of the Division of the Medical Ethics at NYU School of Medicine, Arthur L. Caplan. Arthur, thanks for being here. So give us your sense about what is being taken into consideration for a saga like this. If a COVID or if someone who refuses the vaccine, I mean, can they be turned away from hospitals or clinics? Or is, as I suspect, a lot of gray area on a case-by-case case here?
Well, settings matter. So none of us, believe it or not, have a right to go to the average, if you will, general practitioner or primary care doc. They don't have to take us. There are a lot of people who know that firsthand, can't get in. The person in their town is full or busy. They don't get accepted. They have to travel a long distance to find maybe an OB or a family doc who will take them. And you can absolutely refuse people if you want because they're unvaccinated. There's nothing to stop that from being done out in primary care because we never created a right to healthcare in America. We don't have that. Hospitals, if you're sick and you show up at the ER, they're supposed to stabilize you. You have to be accepted there and stabilized. Do they then have to continue their care? Nope, they could discharge you back out if they felt like it. So I'll say this, primary care, you're going to see more and more docs starting to say, I think I don't want to deal with the unvaccinated. It's a risk to me, risk to my patients, risk to people in the waiting room. I mean, I don't want to deal with that. By the way, we've seen that with pediatricians kicking out parents who wouldn't let their kids get measles shots. Hospitals, a little tougher, probably going to see that less so.
So is it a matter of where it comes down to the personal intentions of the actual medical professional, his or herself, and how big a role does that play? What the goal is of the doctor specifically?
So for the primary care doc, family doc, you're basically watching their values, their views about who they want to deal with, what kind of patients they want to accept. You know, it gets down to even basic things like, do I accept Medicaid? I don't accept Medicaid patients. There's a lot of, if you will, discretion exercised by these frontline docs. And I should add, physician assistants and sometimes nurses get in that role too. They can be very discriminatory as long as it's not religion, gender, race, that sort of thing. When you look over at the hospital side, I think what people are saying is if you're in one of those places, it's getting close to full. If your unvaccinated status makes you sicker, and that's predictive that you wouldn't do as well as somebody else, maybe they would start to take that into account in rationing access to a scarce ICU bed.
Arthur, I'm not a doctor. I never went to medical school. I don't think most of my viewers are either. What is the moral obligation, if there are such a thing, for all healthcare professionals in terms of treating patients that are sick? What is sort of the core of ethics that everyone in this profession should otherwise be bound by as to whether or not they apply to this circumstance or not?
It's asymmetrical. And by that I mean you don't have to take someone on to care for them. That's considered ethically great to do it if you accept all comers, but you don't have to. You don't discharge people, though, without knowing that they have someone else to go to. So that's where we see the concept of abandonment, which is a big no-no in American ethics, American medical ethics. I'll come back to it again. Even though we think, shouldn't the doctor just take care of people who need them? If you go to the doctor and you won't follow the doctor's advice, if you go to the doctor and say, look, here's how I want my care delivered, I believe in alternative medicine, I want you to do this, I want you to do that, they don't have to take you.
I mean, what do you hear from people in the medical world that are having patients show up and say, Doc, I don't want the vaccine. I do want that horse tranquilizer, though, that I heard Congressman so-and-so talk about. I mean, is that a thing that's happening right now? I don't mean to laugh my way through it. It's the absurdity of the circumstance that makes me laugh, certainly not the tragedy of it.
It is crazy, but it is happening. There are people out there who are saying, yeah, I'll take the dewormer medicine. I'll take the thing that basically was great at killing parasites like guinea worm or seems to help my sheep, but I don't want the vaccine that is specifically approved to prevent COVID. And doctors are wrestling with this. You know, there's at least one judge who ordered doctors to deliver a dose of ivermectin to a dying patient when the wife of that guy basically said, I want to try this. I've read about it on the internet. To which my response is, there's no way you prescribe a useless, dangerous drug like ivermectin to anybody under any circumstances. That judge ought to go to medical school if he wants or she wants to start prescribing medicines. But yes, we're in the crazy situation of having people say there are approved drugs, there are approved vaccines. I don't want those. But some guy on the internet told me ivermectin, that's a good thing. I'll try that.
What should people in the medical space be doing, be saying to encourage still vaccine hesitant Americans that it's time to get this vaccine?
Well, look, I don't want to be talking with you about this next year. It's time to push and try to get tolerability. If we can't eliminate COVID, then at least get it down to levels where we might be able to live with it, kind of like the flu. We tried to persuade people. That's great. Move some people. We tried incentives. You'll remember free fishing license, free beer, enter the lottery, get some college tuition. That moves some people. I'll tell you where I'm at. It's time to mandate. Your boss should simply say, you don't get vaccinated, you don't come to work. Your restaurant, your gym, your bar should simply say, you're not coming in here unless you're vaccinated. The government seems unwilling to push mandates. It's time for the private sector to do it, and they have the right and the ability to do it. They can hire you or fire you at will.
Founding director of the Division of the Medical Ethics at NYU School of Medicine, Arthur L. Caplan. Arthur, thanks a lot for taking the time. Great to have your perspective here.